There are numerous problems that can affect the ear, from hearing loss to surfer's ear. We spoke with Dr. Jack Shohet of Hoag Memorial Hospital Presbyterian in Newport Beach to find out what can be done to correct or prevent hearing loss.
Hoag Hospital has just started a head and neck center. We see pretty much anything related to the ears, any type of ear complaint, patients with hearing loss, with ear infections. Surfer's ear is a very common condition around here that I treat. I treat patients with vertigo or balance disorders, patients with tinnitus, which is a noise in the head, ringing or roaring in the ears, and skull base type tumors, tumors that develop in the interface of the head and the skull with the brain, and I treat those as well in conjunction with my colleagues here. We offer a multidisciplinary approach to those types of tumors. 10% of the population, the American population, has a significant degree of hearing loss. 1 in 1,000 children are born with a significant hearing loss. So it's not just a disorder of the elderly, it affects all ages. And I think it's getting more and more prevalent at younger ages given the louder environment that we're exposed to these days. Our environment is getting louder and louder. I mean, the movies are louder. You go into the stadiums and you have those thunderclappers and concert halls. It is tremendously loud in some of those places, and people go home and they have some ringing in their ears. And I'll tell you, if you've been exposed to sound loud enough to cause ringing in your ears, you've most likely caused some damage, whether temporary or permanent, to the inner ear. And that is all cumulative throughout your lifetime. And it will, although you may not be experiencing it right away, over time, it will start to rear its ugly head and you'll start to notice more and more hearing loss, especially in the high frequencies. The chances that we can get your hearing somewhat better are outstanding these days. There's a wide assortment of options that are available to people that have not been previously available, starting with the hearing aids. And we offer one of the widest assortments or varieties of hearing instruments in the county. Implantable hearing devices. There's bone anchor devices to help people with certain types of hearing loss that would otherwise be unable to wear any type of device. There are cochlear implants to help people who are born completely deaf, as we talked about. And finally, there's a whole new frontier, I like to call it, of implantable hearing technology. Hearing devices or hearing aids that are essentially implanted surgically. And some of them are invisible. That's one of the most exciting parts of our field, and I'm very fortunate I've been able to participate in an FDA trial. We're one of 6 centers in the United States and one of 10 in the world that are participating in this FDA trial. One of the first, well, it would be the first implantable, totally implanted hearing device in the United States. We've been seeing some very positive results. It's a very exciting time for us.